A stroke is a serious pathology which affects the brain and can be caused by an obstructed artery, ischemic stroke, or by its rupture, hemorrhagic stroke. There can be a number of first symptoms of a stroke, such as the loss of strength or sensation in an arm, leg, or one side of the body, sudden difficulty in speaking or seeing, difficulty in keeping balance, or a very severe headache, although this last symptom appears only in the case of a hemorrhagic type of stroke. Do not waste time. You have to call 118 immediately, or 112 were activated. On the telephone, the operator will ask some questions about the symptoms. Is your mouth twisted? Do you have an arm or a leg that feels weaker? Is it hard for you to speak? How long have you had these problems? And in the meantime, they will send an ambulance immediately. It is important not to drive or to be taken to hospital by someone else. You always have to call the emergency services because, in particular if it is an ischemic stroke, treatment is effective only if given within 4.5 hours of the onset of the first problems. While waiting for the emergency services, collect the medical documentation, the health card, and the medicines the person is taking. When you hear the sirens, make your position clearly visible. As soon as they arrive, the emergency crew take the first parameters, such as blood pressure and an ECG, sending them to the central operations room. This allows giving instructions to the ambulance crew and rapidly activates accident and emergency and the neurologist. The ambulance then goes to the hospital as instructed by 118, which is not necessarily the nearest one. The siren may not be on. At A&E, the patient is admitted to triage and given some tests, including a brain scan. If it is an ischemic stroke, or if an artery is obstructed, and there are no hemorrhages in the brain, the best treatment is thrombolysis. This means a drug is given that can open the artery that was obstructed. The treatment lasts 1 hour and is well tolerated, but it is effective only if given within 4.5 hours of the first symptoms. Afterwards, the patient is admitted to the specialized ward, where they will be monitored and followed very closely. If, on the other hand, the cause of the stroke is the rupture of an artery, hemorrhagic stroke, thrombolysis is not practiced. The patient, nevertheless, follows the same tests until admission to the ward. In all cases, calling the emergency services quickly and knowing how to behave allows faster help and better care. Call the emergency services. Save a life.